This is Selma Schimmel for the group room at the ESMO 2012 Congress happening now in Vienna. And I'm happy to introduce you to Dr. Maria De Santis, who is the director of the genitourinary program at the Kaiser Franz Joseph Hospital here in Vienna, and chair of the ESMO GU Non-Prostate Task Force. Welcome to the group room program.
Well, thank you for the kind invitation. I'm happy to be here.
What do you think about radiologic diagnostics to evaluate disease progression in patients that did not have chemotherapy?
Well, this is a very interesting field, and in prostate cancer, the question about radiologic evaluation of response and progression is difficult because we have only bone, or mostly bone disease we are dealing with. And in bone disease, there is the problem that it is difficult to evaluate the bone with bone scan, with CT scan or with MRI, and nowadays still bone scan is the standard. So in patients not treated with chemotherapy but treated with hormonal treatment or with androgen biosynthesis inhibitors or anti-androgens, a sort of new endpoint was created following the Prostate Cancer Working Group Guidelines 2. And this new way of looking at progression rather than at response in the studies was implemented into two new trials with abiraterone and with enzalutamide. And here the principle is that in bone scan, we call for two new lesions on the bone scan to evaluate a progression, which has been actually confirmed after some weeks, so that we can be sure that it's really progression and that it is not a pseudo progression caused by a flare in the bone. And this is really important in this patient population because up to 30% of patients might have a sort of bone flare, and we should not see this patient as progressing just because there is a flare in this an uptake in the bone scan that is not really tumor.
Does PET, CT or MRI play any role in diagnostics and evaluation?
Not that much PET CT when evaluating bone, but MRI is very good for diagnostics, for example, a basic evaluation of the spinal cord to exclude soft tissue components of bone metastasis that might cause spinal cord compression. For me, MRI of the spine has become a sort of standard, but this is a sort of special situation in my country where I can afford to do this in patients where I think it is important. But MRI has not become a standard, especially not a standard for bone evaluation within clinical trials. There we have to use those standards to make patients to make things comparable concerning the endpoints. And we try to use all the same standard evaluations like bone scan according to the Prostate Cancer Working Group 2 criteria, and especially the radiographic progression-free survival in those trials without chemotherapy with the new hormonal treatments.
Thank you, Dr. Maria De Santis, Director of the Genitourinary Program at the Kaiser Franz Joseph Hospital here in Vienna, and Chair of the ESMO GU Non-Prostate Task Force.
Thank you for the kind invitation.